There's a particular kind of exhaustion that has nothing to do with how much sleep someone got. It's the exhaustion of getting through an ordinary day, showering, answering emails, having a conversation, while carrying something heavy and invisible that nobody around them can see. From the outside, everything looks functional. On the inside, even small tasks require an amount of effort that would seem, to anyone not experiencing it, wildly disproportionate to what's actually being asked. This is one of the reasons severe depression is so often missed, both by the people around someone experiencing it and, remarkably often, by the person themselves. It doesn't always look like what popular culture suggests it should look like: someone visibly crying, unable to get out of bed, openly in distress. Sometimes it looks like someone's still going to work, still showing up to family dinners, still making jokes, while something underneath all of that has quietly become far more serious than anyone watching would guess. Today we're going to walk through 9 warning signs of severe depression, grounded in the clinical criteria researchers and clinicians actually use, not the vague, often misleading version of depression that shows up in casual conversation. This isn't intended as a diagnostic tool, since an actual diagnosis requires a trained clinician looking at a full clinical picture. It's intended to help you recognize, in yourself or in someone you care about, when what's happening might be more serious than simply a rough patch, and when it might be time to involve real professional support. The first sign is a persistent depressed mood that lasts most of the day, nearly every day, for at least 2 weeks, which is the baseline duration clinicians use to distinguish depression from an ordinary difficult stretch. This isn't the same as sadness that comes and goes in response to specific events. It's a more pervasive, low, heavy quality that colors most of the day regardless of what's actually happening, present on good days and bad days alike, in a way that starts to feel less like a reaction to circumstances and more like the default emotional weather a person is now living inside. The second sign is anhedonia, a term researchers use to describe a marked loss of interest or pleasure in activities that used to be enjoyable. This is considered one of the 2 core criteria for major depressive disorder in clinical diagnostic manuals, alongside depressed mood, and either one can be present without the other, which is part of why anhedonia sometimes gets missed. Someone might not describe themselves as sad at all, while noticing, with a kind of quiet alarm, that things which used to bring genuine pleasure, music, a favorite show, time with close friends, now produce almost nothing, a flatness where enjoyment used to be, regardless of how much they consciously want to feel something different. The third sign involves significant changes in appetite or weight, in either direction, not explained by dieting or a deliberate lifestyle change. This might look like a noticeable loss of interest in food, meals skipped not out of busyness, but because eating simply doesn't register as something worth doing, or the opposite, a marked increase in appetite, particularly toward comfort foods, as a way of self-soothing against the underlying heaviness. Clinicians typically look for a change of around 5% of body weight within a month as a meaningful threshold, though the pattern itself, appetite shifting substantially in either direction without an obvious external cause, matters more than any single number. The fourth sign is a disruption in sleep, again in either direction. This might be insomnia, difficulty falling asleep, staying asleep, or waking far earlier than intended and being unable to fall back asleep. Or it might be hypersomnia, sleeping considerably more than usual and still waking exhausted, using sleep as a way to escape hours that otherwise feel unbearable to be awake for. Sleep and mood share a particularly close, bidirectional relationship. Disrupted sleep worsens depressive symptoms, and depression itself disrupts the sleep systems that would otherwise help regulate mood, which means this particular sign often becomes part of a self-reinforcing cycle rather than a simple side effect. The fifth sign is what clinicians call psychomotor changes, either agitation or slowing, visible enough that other people sometimes notice it before the person experiencing it does. Psychomotor agitation might look like restlessness, an inability to sit still, pacing, fidgeting driven by an internal unease that has no obvious outlet. Psychomotor retardation looks like the opposite, a noticeable slowing of movement and speech, a kind of heaviness in physical presence, as though every motion requires wading through something thick and resistant. Family members or close friends sometimes describe noticing this shift, that someone simply seems to move differently, before the person themselves has put language to what's happening internally. The sixth sign is fatigue or loss of energy that persists nearly every day, distinct from ordinary tiredness in that it doesn't meaningfully improve with rest. This is often one of the more physically disorienting symptoms of depression, since a full night's sleep, or even an entire restful weekend, fails to produce anything close to the recovery a person would reasonably expect. Everyday tasks, showering, making a meal, replying to a message, begin to require an amount of effort that feels entirely disproportionate to the task itself, not because the task has become genuinely harder, but because the underlying resource needed to do ordinary things has been substantially depleted. The seventh sign is feelings of worthlessness or excessive, inappropriate guilt, often about things a person wouldn't have blamed themselves for before this period began. This might sound like a persistent internal narrative of being a burden, being fundamentally inadequate, or carrying blame for circumstances genuinely outside their control. Clinically, this is distinguished from realistic guilt about an actual mistake by its scope and its persistence, less a specific, proportionate regret, and more a pervasive sense that something is fundamentally wrong with who the person is, a narrative that tends to resist evidence or reassurance offered from the outside. The eighth sign is diminished ability to think, concentrate, or make decisions, sometimes described by people experiencing it as a kind of mental fog. This might show up as difficulty following a conversation that would normally be easy to track, struggling to make decisions that used to feel straightforward, choosing what to eat, what to wear, or losing the thread of a task partway through and being unable to locate the focus needed to finish it. This symptom is often underrecognized because it's easy to attribute to simple distraction or stress, when it's actually a well-documented cognitive feature of depression itself, connected to changes in how certain brain regions involved in attention and executive function are functioning during a depressive episode. The ninth sign, the most serious and the one that requires the most direct and immediate attention, is recurrent thoughts of death, suicidal ideation, or a specific plan. This exists on a spectrum from passive thoughts, a sense that it would be easier not to exist, without any specific intent or plan, to active ideation, thinking specifically about ending one's life, to the presence of an actual plan, which represents a considerably more urgent level of risk. Any presence of this ninth sign, even in its most passive form, warrants taking the broader situation seriously and involving professional support without delay, because passive ideation can, without treatment, progress toward more active and dangerous forms of the same underlying thought pattern. It's worth naming something important about how these 9 signs actually show up in real life, which is rarely as a complete, textbook checklist all appearing at once. Clinical diagnosis generally requires 5 or more of these symptoms present most of the day, nearly every day for at least 2 consecutive weeks, representing a clear change from previous functioning, with at least one of the 2 core symptoms, depressed mood or anhedonia, present. But outside a clinical setting, most people notice a partial, evolving picture rather than a complete list, 2 or 3 signs at first, gradually joined by others as an episode deepens, which is part of why severe depression can be so difficult to recognize in its earlier stages, both for the person experiencing it and for people around them. Consider a composite example. Someone we'll call Daniel, a well-regarded teacher who continued showing up to work every day, preparing lessons, engaging with students, for nearly 4 months before anyone close to him recognized the severity of what he was experiencing. Daniel wasn't visibly falling apart. He was, by most external measures, still functioning. What had changed, in ways only he and eventually his wife noticed, was considerably harder to see from the outside, a persistent flatness that colored every part of his day, a loss of interest in running, something he'd done religiously for a decade, sleep that had become fragmented and unrefreshing, and a quiet, persistent sense that he was failing everyone around him despite no actual evidence that this was true. It was a conversation with his wife, who noticed he'd stopped mentioning anything he was looking forward to, not next week, not next year, nothing at all, that finally prompted him to see a doctor. Daniel later described the months before that conversation as functioning on a kind of autopilot, capable enough to maintain appearances, while something underneath had become considerably more serious than either he or anyone around him had recognized in real time. His case illustrates something important about severe depression that doesn't always match the more visible, dramatic portrayal often shown in media. It can coexist, for extended periods, with continued functioning, which makes it considerably easier to miss, minimize, or explain away as simple stress or a temporary rough patch. It's also worth addressing a few common misconceptions that tend to complicate how people recognize these signs, both in themselves and in others. One frequent misconception is that depression always has an identifiable external cause, a breakup, a job loss, a specific loss or setback that explains the shift. While difficult life events can certainly trigger or worsen a depressive episode, clinical depression can also develop without any clear external trigger at all, arising instead from a combination of biological, genetic, and situational factors that don't always trace back to one obvious cause. This matters because someone experiencing depression without an identifiable trigger sometimes dismisses their own experience, reasoning that nothing has actually happened to justify feeling this way, when the absence of an obvious cause doesn't make the underlying experience any less real or any less deserving of support. A second misconception involves confusing depression with ordinary grief, particularly after a genuine loss. Grief and depression can share surface similarities: low mood, disrupted sleep, reduced interest in usual activities, but they tend to differ in a few meaningful ways. Grief typically comes in waves, often triggered by specific reminders of the loss, with periods of relief and even genuine positive emotion in between. Grief also tends to preserve self-esteem. A grieving person misses someone deeply without necessarily feeling worthless as a result. Clinical depression, by contrast, tends to be more persistent and pervasive, less tied to specific reminders, and frequently accompanied by the kind of pervasive worthlessness described in the seventh sign, a felt sense that something is wrong with oneself rather than simply painful longing for someone or something that's been lost. A third misconception, particularly damaging because of how often it delays someone from seeking help, is the belief that depression is simply a matter of willpower or attitude, and that someone experiencing it should be able to think their way out of it if they just tried harder. This framing misunderstands what's actually happening neurologically and physiologically during a depressive episode, and it tends to compound the seventh sign, feelings of worthlessness, by adding a layer of self-blame for not being able to overcome something through effort alone. Depression is a recognized medical condition with well-documented biological underpinnings, not a character deficiency, and treating it as a simple failure of willpower tends to prevent people from seeking the kind of professional support that actually helps. This points to a genuinely important distinction worth naming directly: the difference between ordinary sadness or a difficult period, which everyone experiences and which generally responds to time, support, and changed circumstances, and clinical depression, which tends to persist regardless of circumstances improving, resists the kind of reassurance or problem-solving that would normally help, and involves the specific cluster and duration of symptoms described above. This distinction matters because treating clinical depression as though it were simply a mood that needs cheering up or that will pass with enough willpower tends to delay the kind of professional support that actually helps, sometimes for months or years longer than necessary. which everyone experiences and which generally responds to time, support, and changed circumstances, and clinical depression, which tends to persist regardless of circumstances improving, resists the kind of reassurance or problem-solving that would normally help, and involves the specific cluster and duration of symptoms described above. This distinction matters because treating clinical depression as though it were simply a mood that needs cheering up, or that will pass with enough willpower, tends to delay the kind of professional support that actually helps, sometimes for months or years longer than necessary. It's also worth naming what tends to help once these signs are recognized, since the point of naming warning signs isn't simply to produce worry, but to point toward action. Depression, including severe depression, is treatable through evidence-based approaches including psychotherapy, particularly cognitive behavioral therapy and interpersonal therapy, which have substantial research support, medication where clinically appropriate, and in more severe or treatment-resistant cases, additional interventions a psychiatrist can discuss directly. The specific right approach varies considerably from person to person, which is precisely why professional evaluation matters, rather than relying on generic advice or self-directed coping alone for something this significant. If you recognize several of these signs in your own experience, particularly if they've persisted for 2 weeks or more and represent a real change from how you typically function, the most useful next step is speaking with a doctor or mental health professional who can assess the full picture accurately in a way no list, however thorough, can replicate on its own. If you recognize these signs in someone you care about, particularly the 9th sign, thoughts of death or suicide in any form, the most helpful thing you can do is ask directly and without judgment, and help connect them with professional support rather than assuming the situation will resolve on its own. Here's the insight worth carrying out of this. Severe depression rarely announces itself the way people expect it to. It often hides behind continued functioning, behind a person who still shows up, still smiles in the right moments, still carries their responsibilities, while something considerably heavier moves underneath the surface. Recognizing these signs, in yourself or in someone else, isn't about assigning a label. It's about noticing early enough that the right kind of help can actually make a difference, rather than waiting for a crisis to make the severity impossible to miss.